welcome to Doc Talk on this Thursday, May the 11th, on this absolutely gorgeous day here, actually in King City on a patio. It's a beautiful, glorious summer like evening, and we are enjoying nature, we're enjoying the beautiful weather. And tonight, we're going to jump right into a topic that's actually been garnishing a tremendous amount of attention in the media, and that is the whole topic of the gender issue and dealing with biology as we once knew it and what we call the blurring of biology or the distortion of biology, where once it was established that there were two genders and unequivocal that there are two genders based on genetics and based on um, observations, very obvious observations of gender identity and gender physical appearances, we now have a blurring and a distortion of that line. And organized medicine is very much involved in this. Organized medicine is very involved with the entire transgender agenda and transgender movement and promoting it very much so. We welcome you aboard, and we are actually aiming to have this to be very interactive. It's not so much didactic where I'm giving you information, education. There'll be some of that, but mostly it will be your involvement. So I hope that you jump on and enjoy the next 45 minutes or so. So um, this is what we're seeing. We're seeing uh, very aggressive surgical intervention and young girls and young boys in an attempt to change their physical appearance to the gender that they feel that they are, not the biological gender that they actually are physically and obviously, but the gender that they feel that they are. And so we're having so-called masculinization chest surgery, which is essentially mastectomy, which ordinarily is a radical operation for breast cancer, advanced breast cancer. And we're having even facial surgery with facial reshaping of the facial bones in the case of a girl wanting to be a boy, uh, changing the whole configuration of her bone structure in the face, and of course pelvic surgery, including oophorectomy, removing of the ovaries, hysterectomy, removing of the um, of uterus, and uh, basically removing the tubes as well. So um, here we are. Also, another topic, of course, in this whole agenda is the transgender appearance in sports. So we have men, biological men, identifying as being biological women and competing, obviously, with a huge biological advantage of muscle mass and physical strength, and essentially competing, what many would say would be unfairly, in women's sports. So here I'm going to just also have the comments available here. So for you who are on any medium, please feel free to just write a comment and it'll appear here and I'll put it up on the screen. If you prefer to have the comment be confidential, just indicate that in your comment. So in addition to this, we now have biological men identifying as teenage girls. The case of Dylan, of course, uh, gained great notoriety, has now over 1 million followers on Twitter, and essentially he, or identifying as a 13-year-old girl, is being used to market everything from purses to beer to many other large corporate um, uh, commercial marketing. And then we're going to be basically asking questions regarding this. And I really hope that we have a good, robust discussion. This has been a long time coming, and I appreciate your patience for this. But essentially, this is the questions that we would like to ask. So the first question is going to be, I'm going to put it on a bigger screen here. Why did the treatment for gender dysphoria change? So, up until just the last few years, gender dysphoria was identified in the psychiatric literature, what we call DSM or Diagnostic Manual for Psychiatry, as a pathological entity, a mental disorder. When someone, like for example, a girl, is obviously a female genetically, physically, and feels that she is a boy. that used to be and still is called gender dysphoria. And the treatment for that was psychological and psychiatric treatment to help her to adapt to the fact that she is biologically female. So the treatment has now changed radically, where it's still identified as a disorder. And here's a paradox: it's identified as a disorder, but it, rather than treat it to have the person adjust to their own biological assignment, the treatment now is to push, and organized medicine is really behind this. Thank you. What's that?
Somebody's calling you.
Oh, okay. Just excuse me for 1 sec. Okay, excuse me for one moment here.
Sorry, that's not
Oh,
your
sorry.
fault.
Okay, sorry. I just had an interruption here on the patio, so
Okay.
no problem. Thank you. Um, so now the treatment is to reconfigure the entire physical appearance of that girl. So essentially, give her hormone blockers, block her estrogen development, progesterone development, and have her undergo a radical transforming radical surgery. So that's where we stand. So that's the first question: is why did this treatment all of a sudden change in the last few years? Second is thoughts on age of consent. We're seeing younger and younger ages of consent being pushed by governments, by doctors, so that now children essentially are allowed to consent for gender, quote unquote, gender reassignment surgery or radical mutilating surgery in order to change their physical appearance to approximate that of the opposite sex. So I want to get your thoughts on whether you think the age of consent is appropriate at such young age, 6 to 8 years of age. So, and then we're going to also address the question of transgenders in sports and what your thoughts are on that. Is there any role for example, biological male competing in biological female sports? Um, just have this here, and we're going to address um, people by their preferred pronouns. We're going to ask that question: do you address a person by their preferred pronoun or not? So just let me know about that as well. And then finally, the last question is: why do people who are not transgender assign themselves pronouns? So obviously, there's people that are biologically clearly male, biologically female, and yet they'll put, for example, on their Twitter, he, she, her, he, him, them, and why are they doing that? Is it to appease the transgender movement, or is it respectful, or is it feeding into um, distorted or blurred biology, if you will? So, okay, so let's have your thoughts here. So we're going to address the first question, and the first question is: why did the treatment for gender dysphoria change? So I appreciate your thoughts on that. So the treatment for gender dysphoria used to be basically trying to help the person adapt to it. So um, it seems to me, for some reason, uh, we're having people not being able to log on. So just give me one moment, and I want to see if there's any technical issues or whether we are live. Okay, so it appears that we are live, and obviously I don't want this to be a didactic session, um, so I'm gonna just stay on here for a little bit. I see there's appears to me that there's only one person at the moment that is on board. Okay, so I'll stand by for any comments, thoughts on age of consent. You can address any of these questions. Transgenders in sports. Do you address people by their preferred pronouns? And why do people who are not transgender assign themselves pronouns? And maybe we can address these questions. So Here they are. Okay, so I think it appears to me that for whatever reason, this is not aligning with people's schedule. Ordinarily, by this time, we have close to 20 people on. So I do have something very exciting, and that is next week, announcement for next week. So I'm just going to go ahead. And at this point, since there are no comments and we're not engaging in a discussion, there must be a logistical issue with timing. So next week we're going to have on Doc Talk um, a very special guest, and that's Laura Lynn Thompson, a renowned world journalist and broadcaster. I worked on Christian television with 700 Club, and so we're very excited to have her on here, and she'll be coming on board with us next week. So, okay, so right now I'm going to end the broadcast, and we hope that you will join us next week.